Good morning, everyone. First off, thank you so much for attending my talk and the summit as a whole. And before anything, I'd like to thank all of the speakers and attendees for lending their valuable time to contribute to this event. It truly wouldn't be possible without all of you. To get started, I'd like to introduce myself. I'm Nicole Senson, the current VP of Products and Services at Clinica Technologies. Today, I'm going to be introducing the concept of Clinica Technologies for next generation health services. And here, when I say health services, I'm referring to clinics, hospitals, and other services such as pharmacies, imaging centers, pathology services, and more. So at Clinica Technologies, we categorize health services into the categories of first generation, second generation, and third generation. However, our categories, they're arbitrary. It serves as the foundation to build the conceptual framework about the historic and current models of health services. And this also helps us design and envision the future model. So without diving into too much detail about each model, I'd like to point out what distinguishes these from one another. First, the first generation model belongs to the pre-industrial age. And next, the second generation is the one that is currently being used in the industry. And finally, the third generation model will be based on information technology, especially after the COVID-19 pandemic and its shifts in healthcare. So for this talk, I'll be focusing on the next generation, or otherwise called the 3G health services. Here we see 7 aspects, and these serve as the properties or features that define 3G. And most importantly, this is what distinguishes third generation from the second generation. We have connectivity, hybrid delivery, patient-centered, automation, scalability, accessibility, and valued providers. With the first property, we'll discuss connectivity. When we say healthcare will be connected, we mean it will be fully connected, meaning every single player in the healthcare ecosystem will be fully connected to one another. To further put it in context, we can take a single GP clinic with 10,000 patients, 10 practitioners, and 20 clinics or health services as partnered institutions. Here, every healthcare provider, healthcare staff member, every patient will all be fully connected. Now the question is, how will this degree of connectivity be achieved? This is made possible by creating a digital twin of the physical clinic. It would be the digital version of the service. So for every physical clinic, there is a cloud-based platform that is two-sided. So this means that it's accessible to both practitioners and patients alike. And the difference with second generation is that patients aren't connected directly. The direct connection is typically between provider and provider. So here we see the physical operating system of second generation, and yes, the patients, doctors, and clinics are involved in this realm, as any patient can go to any clinic they may choose. But by creating a digital clinic system to be the parallel, it paves the way for instant communication, which fills in the gap of the physical system where a communication delay exists. So here, each provider and each patient is entitled to their own suite, and this layer is where instant communication takes place. And third generation does not wish to eliminate the physical system of healthcare. Future 3G clinics consist of the physical 2G layer plus the digital layer for instant connectivity. So next we have hybrid mode. This means that the services provided can be delivered in hybrid mode, where the patient can choose to receive care through telemedicine, remote consultations, and remote monitoring, or at the physical clinic. So in essence, third generation does not impose which services the patient should choose. They are given the freedom of choice, and in this flexible hybrid mode, the patient gets to choose. And the same goes for the doctors and healthcare staff. They too experience the flexibility of the hybrid mode. And with this, healthcare can be achieved through the physical and digital layers based on what the patients prefer. So here we will discuss the patient-centered and patient-enabled healthcare. So in this aspect of 3G healthcare, it relies on working in real time. So by this, interactions between all of the involved providers and patients can happen in real time, and with that, there's no time lost in communication. This all results to information being shared instantaneously. So with a patient-enabled and patient-centered approach, the system looks after the patient and their interests. In Gen 2, it's semantically patient-centered, where it does work for the patient's interest, but not necessarily in the technological aspect. So yes, care is provided to the patient, but the patient does not and cannot drive their very own care. On the other hand, in third generation, the patients are given the necessary tools to coordinate their own care as their digital patient suite is connected to others. And essentially, patients get to pick and monitor the details of their care, and whereas now the providers pick and the patients are not digitally enabled. Next, we have automation. And when we say automated, we do not imply full automation, as this works through different levels and different degrees. Automation refers to care being automated, and this also doesn't assume AI or digital automation. It could also be human automation. Additionally, we can differentiate automation based on tasks. For administrative tasks, these refer to patients making payments and forwarding their medical records, and these are essentially patient-driven. And we also have clinical tasks, which refers to clinical decisions being made. And apart from differentiating the tasks, we also identify the drivers of such automation, which are providers, healthcare staff, patients, and AI and algorithms. Going into further detail on the drivers of automation, we'll be discussing each. So with provider-driven automation, it's centered on provider-to-provider navigation and provider-guided navigation for patients. So existing with different care protocols and guidelines, the next level envisions care that is navigated by the provider by setting up journey maps for patients and allowing them to follow instructions. And these instructions refer to simple automation tools to create provider-guided navigation of care. And alongside provider-driven, patient-driven automation also works hand in hand. This can happen through independent patient navigation or provider-navigated yet patient-driven care. So this might be difficult to visualize, but here patients can navigate themselves through bookings, consultations, electronic medical record submissions, and sharing necessary documents. They also hold autonomy over the safe part of administrative tasks to create patient-driven navigation. And lastly, we have navigation based on AI algorithms. It assumes administrative, logistical, and clinical tasks as providers are in the loop. Through this, automation of different tasks will increase and increase over time. And with our fifth feature, we have scalability of healthcare. With our current 2G health services, the scalability is undeniably limited. And when we speak of limitation, we identify the limitations by geography, communication, and automation. So in the context of our current second-generation model, it's centered on brick-and-mortar physical clinics. Each provider is limited to a localized population. And a boundary is placed which we could estimate to be 5 to 10 kilometers in radius as a patient's driving distance or traveling distance. And additionally, it makes use of analog communication, specifically by telephone. And with physical travel and time delay in communication, and overall this physical system, it cannot be scaled. It is contained within a limited capacity for the patient and inevitably becomes local. In this context, patients are passive receivers and consumers of healthcare. This means that healthcare happens to them. They don't have the power to acquire it. But with 3G, we experience automation and hyperscalability. So this begs a new era of healthcare that is hyperscalable, that is driven by a smaller capital yet wider scope. And by geography, it is not limited by physical location and its scope. The limitation is only upheld by the regulatory boundary of one's medical services, which is on a national scope. With communication, it utilizes the same digital platform within the same ecosystem with all the patients and providers interacting and communicating in real time. And with physical premises, the need for it minimizes, and with that, the cost is reduced as transactions take place on a digital platform. And with automation, it promotes a patient-driven approach as patients are fully involved and fully connected. So ultimately, 3G becomes nationwide. You are given the room to scale the service across the country with communication tools made instantly accessible. And in third generation, distance is not a factor and the boundary expands to a national scale. With accessibility, this is straightforward. So with both a physical and digital parallel, healthcare is instantly accessible to patients at any point of the day, and so is communication. In this setup, it also factors in affordability. By bringing in automation and scalability, the cost of the service is minimized. And this also takes place as competition on the digital layer takes place. So the patients here hold the cards as a driver and full active participant. So healthcare services are abundant in the digital layer, and the patients get to choose, and this is where the competition and affordability comes in. Lastly, we have value providers. Again, due to the automation and scalability, the most precious and most sought after resource will be healthcare providers, doctors, nurses, administrators, and allied health. The demand for healthcare providers will increase, and with this shift, pays will increase, their working environment will improve, hybrid and flexible work will become a norm, and with such a high demand for this trained, licensed, and registered human resource, they become the limiting factor in scalability. So the providers of the service will be rewarded by default, and these services compete for the human resource. Digital Clinica is your online medical practice by bringing health services onto a digital platform. So starting off, we have the registration, and while it is a multi-sided product with 3 different user types, which are admin, staff, and patients, this walkthrough will primarily be from the admin's point of view, and then we'll move on to the patient's point of view. So after filling out all of the personal information, you can select the plan that fits your needs, and aside from being able to select which clinical products you wish to avail, you also have flexibility with the number of staff and patients you'll be enrolling. And by having this form of flexibility, a practice is given a wide range of health services that can be transitioned online and without having to overspend, as you can select the range of users you anticipate. And so after confirming your plan, you have multiple payment options and a summarized breakdown. And once everything is complete, you can click on place order. So after successfully registering and logging into your admin account, you can head to your dashboard and directory, and on your dashboard you have shortcuts to applications, users, billing, settings, and more. And over here on directory, you'll be able to manage your users and groups. So with user management, you'll have an overview of your users by or enrolled staff by name, email, last sign-in, storage usage, and status. And to add a single user, just click on Add User button and fill in the necessary information. And now you can track their status, whether they've successfully been added or if it's still pending on their end. And also as an admin, you can add your users in bulk through the Import User button. And we've provided a format for your CSV file in order to have a seamless upload and import. And after that, your user list should update. So by providing 2 different options for adding users and a straightforward process for both, this accommodates any given size and technological capacity of a practice. So still under management over here, you can delete users and make other users admins, and under edit user, you can access these 5 sections on a per user basis. So here, you can view and edit their enrolled information and settings, and also under security, admins can reset their passwords if needed. You can also assign their roles in their groups, which we'll further discuss under group management, and you can also select which applications they have access to, and lastly, you can assign other admins. And moving on, local stack can be enabled to allow our users to access their online medical practice even without access to Wi-Fi, but of course this does not apply to other services like video consultations and such. So with the transitioning dependence on online platforms, outages have been a big concern. So with an offline option, it makes use of a local data server, and any sudden outages on either of our ends would not prevent practice from operating, and this would allow the live sync of data between practices and sub-practices. So to make use of this, we provide installable files and system requirements. So after the installation is successful, you can monitor the status of your local stack access. So still under directory, you also have group management, and on here you can create groups, and this is to limit access or for mere organization. And so for example, you can group them by location and user type like so. So to reiterate the aspect of management, you can edit the settings per group, and here you have interaction settings as an admin, and tying to user management and group management. These two aspects allow a practice to have complete knowledge and control of access within their workspace, whether it concerns sensitive data to emphasize security or mere segmentation to stay organized. So moving on from directory, we have billing, and this is where you can edit your billing address and also your current subscription with details on payment methods and next scheduled payment. And if you wish to upgrade your current plan, click on the Upgrade Now button, and this will redirect you to the original checkout page. And under Account Settings, we have Personalization, and this is our take so far in relation to white label. So for every practice, you can include your own logo, adjust the text and background color, and here on the right side, we have a preview of your current selections, and once everything is finalized, the changes should reflect in real time after saving. And ultimately, this allows the practice to assume their own identity onto their digital platform. So next, we have data migration. So this is, of course, an existing practice already has their pre-existing data from a different software, and by importing their legacy files, this feature paves the way for data interoperability. You can transfer your records and data from practice to practice or entity to entity. So to proceed, just input your migration source, data type, connection protocol, and login credentials for authorization. And so by going to applications, you can select which applications you wish to use, and this is based on the one you availed on your plan. And so under Digital Clinica, you can create your own ecosystem of online health services for your practice. So for example, within DocuVault, you can access and upload and manage your stored files as if you were using the standalone product. And again, this is multi-sided for practitioners, providers, and patients. So here's a preview of DocuVault as integrated to Digital Clinica and as well as standalone. And next, we can go with Clinica Letters, where you can compose and save your correspondence and use and create templates and also add e-signatures. And you also have access to your contacts and your sent letters for tracking. So now going into detail with Clinica Navigator, this is your self-driving platform in healthcare. It's designed for providers, practitioners, and patients. And so if this is integrated into your practice, you can directly access this through your Digital Clinica. And just like the standalone app, you can browse the pre-existing medical journey templates as well as create new ones as you like. And this is for a provider or practitioner's point of view, where you have a complete list of your enrolled patients for seamless tracking and monitoring. So next, this is on either point of view, this is the mind map for your patient journey, and as well as a calendar to keep track of your upcoming appointments or events. We also have Clinica Records, which is designed for electronic medical records, and as you can see, here are your records that are organized by multiple fields and statuses. And next, you can also select the preferred notification platform on here. So this is a preview of Clinica Records. We also have Clinica Connect, which is our application for telehealth and telemedicine consultations. So this is for video consultations. But of course, aside from the products mentioned, we provide a wide variety of Clinica products that can enhance your online medical practice, whichever fits your needs best with flexibility and autonomy. So now that you've seen it from the admin's point of view, this is now shifting to the patient's point of view of Digital Clinica. So first off, this is their dashboard if they are enrolled under a healthcare provider such as Johns Hopkins Medical Clinic, and this also displays the personalization that was previously discussed. So here they can see the applications that they're enrolled in based on their provider. And also, Digital Clinica can be used by an independent patient who wasn't enrolled under a healthcare provider, and this would be their dashboard where we suggest self-help and applications in healthcare. So here we have an enrolled patient viewing the applications made available to them by their respective admins, and for example, using Clinica Letter within the platform. Also editing their profile and monitoring their current subscriptions as an independent or enrolled user. Also viewing their applications again and editing their profile as an independent user. So that wraps up the walkthrough of Digital Clinica and Digital Patient, wherein we've viewed the online practice from multiple point of views, such as admin, practitioner, and patient. So as we look into the future of healthcare and the next generation health services, it is important to clearly distinguish what sets it apart from the current norms of the industry. So these 7 features of connectivity, hybrid delivery, patient-centered, automation, scalability, accessibility, and valued providers, this is what will mark the gradual shift to third-generation healthcare. So thank you so much for attending my talk. Should you have any questions, I provided my email on here. And thank you so much again for all the speakers and attendees in Clinica Summit 2022.